Did you know that blood sugar dysregulation can lead to many of the chronic illnesses that people suffer from today? Hi, my name is Dr. Sharon Borkowski with Naperville Integrated Wellness. Diabetes is the most common disease related to poor blood sugar regulation. Over the next few minutes, I will discuss the main types of diabetes and how they occur. I will also discuss some of the other blood sugar problems and the symptoms associated with them. Then finally, I will share ways that you can resolve blood sugar imbalances and ways to avoid some of the long-term consequences of the most severe blood sugar problems. The three main types of diabetes include type 1, type 2, and gestational diabetes. These account for the highest percentage of cases of diabetes. There are many other subtypes, but that is beyond the scope of this discussion. To understand diabetes and other blood sugar issues, you need to understand the players. One of them is blood sugar or glucose, and the other is insulin. Blood sugar is the main fuel that cells utilize to make energy, and it's normally kept within a certain range in the blood. This is a complex system that I won't be getting into, but it is handled by the interplay of various organ systems in the body. Insulin provides a unique function to the cells by allowing glucose into the cell from the blood. Essentially, insulin is like a key that opens the door to let glucose into the cells. Now, we get glucose into the blood from three basic ways. One is via the food that we eat. Two is via storage that is in the liver and to a lesser degree in muscles. And three, the body can actually make glucose. As blood sugar levels rise in the blood after we eat, for example, the pancreas produces insulin to drive glucose out of the blood and into the cells. Now, on the other hand, when blood glucose levels decrease, like when you're asleep or fasting, the adrenal glands will secrete adrenaline and cortisol to cause the liver to release stores of glucose into the blood. Now that I've covered the basics, I want to talk about some of the conditions that occur when there's too much or too little glucose in the blood. This can mean that certain mechanisms are not functioning well to restore the levels to where they should be in the blood. Now, chronically high glucose in the blood is the characteristic early sign of diabetes. And diabetes leads to a whole lot of other conditions as well that I won't be getting into today. Type 1 diabetes occurs due to an autoimmune condition causing the destruction of cells that make insulin. And without insulin, we can't survive. So this person requires insulin medication for the rest of his or her life. Now, early type 2 diabetes is typically characterized by what's called insulin resistance. This is a condition whereby insulin is created by the pancreas in higher and higher amounts to counteract the high levels of glucose in the blood. Type 2 diabetes can eventually progress to insulin dependence when the pancreas can no longer produce sufficient insulin. Gestational diabetes is a condition of insulin resistance that's created during pregnancy. And this has to do with the hormones produced during pregnancy that make insulin less effective. This condition can and often does resolve post-pregnancy. Just for a quick recap, blood sugar is glucose in the blood and comes from the food that we eat. It comes from reserves that are stored in the liver and the muscles, or it can be made in the body. Insulin is produced by the pancreas on demand and drives sugar from the blood into the cells to be used as fuel for the cell. So far, I've talked about conditions that relate to high glucose, also known as hyperglycemia. Now I'm going to talk a bit about low blood sugar, or what's called hypoglycemia. The most common cause of hypoglycemia occurs in insulin-dependent diabetics when they take too much insulin. Now I want to point out two other types of blood sugar conditions. One is called reactive hypoglycemia, and the other is called fasting hypoglycemia. Reactive hypoglycemia occurs between 2 to 4 hours after a meal. Fasting hypoglycemia occurs when a person goes 7 or more hours without food. Now, researchers are not completely sure about the exact cause of non-diabetic hypoglycemia, but it may have to do with the problems in the regulatory mechanisms that are designed to maintain blood sugar. Now, as you can see, there's a spectrum when it comes to blood sugar regulation in the body, and there are many players involved. And getting to the root cause of blood sugar issues and restoring proper regulation can be a very complicated matter. Now, when it comes to this, I'm going to point out the functional medicine health pyramid. If you're not familiar with this pyramid, it has 10 different levels, and items on the bottom of the pyramid contribute to the items above it. So, for example, level 1 is diet and nutrition, and that has to be addressed in order to handle blood sugar issues. Level 2 is detoxification, and level 3 is blood sugar problems. Now, functional medicine's goal is to get to the root cause of any illness. Now, what that means is we have to address each of the levels below in order to deal with any sort of blood sugar issue. If you'd like to learn more about blood sugar issues and how to resolve your symptoms, reach out to us at napervilleintegratedwellness.com.